Welcome to everyone. Today we are going to study about the excretory system. It is generally what we are learning here. It is bare basic, bare minimum. It is not in the medical school level, or you can say it is a primary level. But you should understand, because since we as a spiritual healer should know what is happening inside the body, not in very depth, but no, grossly you should know what is happening, what is the urinary system is doing, and what are the common problems of that, and what are the remedies with us. How can we know address to those things? We will study. Okay. Today, the kidneys, everybody, even like first everybody is scared about liver, and the second everybody is scared about the kidneys. I think all over because more frequently the liver is getting affected, less frequently or next level the kidneys are affected. Means it is visible change. We'll get a visible change. So people are scared about it. The people are not scared about the heart problem. Why? Because there is no any visible change we get. Only we get at the end of it, or it will end with us. So like that. So anyway, so we'll start the positioning of the kidney. Let us see what we can learn. And we have wonderful videos today. And we have a post-mortem video, so that everything we can see in the animation, but how does really actually look within our body, na? Visual that our animation gives clear idea that what is happening inside our body and what is happening inside the kidneys and bladder and ureter. It will give you clear idea, but it is only only for remembrance. And now we are going to, in one of our video, actually how much big is the ureter, how much big is the kidney, and how these pyramids in the kidney are looking. We will all see that. It's very interesting to me, because, and it doesn't mean that, it is only for, I'm telling you, educational purpose only. Educational purpose, not, I know. Hey, I know about kidney. Let us operate. Don't try to operate. Okay. So, and I know where, how to do it. And this all, sometimes, some people, they become overconfidence and, start doing. It is for that is a statutory warning, or I can say it is for only educational purpose to understand more about kidney. Okay. Let's go to the next level. So where let us start with our PPT. PPT is simple, very simple. This is a positioning of a kidney. It is from the back, it is very much approachable, and sometimes the back pain is, no, if there is there any back pain, they sometimes they think about the spinal cord problem and neglect it, and sometimes it is maybe the kidney problem also. Okay, so in from the front, how it looks, and it is from just the exactly the back side of the front side from the rib and back side, and generally it is more at the back, so that the all the complaints about the back pain and everything that corresponds to the kidney problem. And kidney is parts of the kidney. Kidney means what are the steps of the kidney? Kidney is They were located at this place. And how the kidney one, there are two kidneys, left and right. It is in the shape of the beans. And so sometime, it is a rajma is also called a kidney beans, and there are so many beans. They are in the shape of the kidney. And what is there here? What is the main function of the kidney? Then let us see that, I have already shared you the anatomy physiology, that PDF. In that one, in short, they have given explained very nicely that I already pasted it here, so that, okay, anatomical structure. So yes, from kidneys individual, and what are the subparts of the kidney? That is main is this pyramid. It is called as a pyramid. In that one, what all there? Glomerulus are there, renal medulla and renal cortex. These are the main part of the kidney. We will see it in a video where very beautifully explained. Okay. So why these kidneys are required? Because to filter the blood. What happens? When our cell, we are working, we are alive, or you can say we secrete many waste product, like what we eat, it is passed as a stool, and what we drink, water, is mostly, you know absorbed in the intestine, and recirculate. There is a lot many things we'll understand here. It is recycled. Like, in a big apartment, it is in a government restriction that you should, in for the toilet, you should use the recycled water. So likewise, it maximum it is recycled, and waste product are mixed with the water and excreted. So in this total chain, if any problem comes, that time we can call it as a kidney disease, and we will see the different kidney problems which are arising, and what is the solution according to our Vibrionics. Okay, so let me see what I can show you. Okay, structure of the kidney, a bean shaped organ, and retroperitoneal space on each of the one side of the spine. Renal cortex medulla, the outer region of the kidney is a renal cortex, and this is the main. There are a lot of, if it is for use for the filtering the blood. That means there should be a lot of blood vessels, and the capillaries and smaller than that, arterioles it is called. In the lungs, what we called, that where gases exchanging is happening, that is alveoli. The similar way, the end structure of the nephrons are called, or the arterioles, very very small things where, cup like structures. You'll see here, you see, and see, it will be all surrounding by the tubes, and here that blood uh, the blood comes, and this is a uh, this is a capsule like structure where exchange take place. This is due to osmotic action. See, where we use another osmosis, where we generally use a osmotic principle in our day-to-day life, that is in the
RO water.
RO water. filters, or a filter, the similar thing based on the that's the same principle with the electrolyte. This action is taken by the nephrons in the kidney. So there will be huge number of that nephrons. For that reason only, kidney diseases are detected at the end of the breakdown point. Means they are not detected at the early stage. Why? Because why generally happens, the why generally that kidneys are failing. What is happening here? So while this filtration, if that sugar level is high, it damages these parts. And secondly, there are main two reasons why this kidneys generally or nephron do not work. One is because of high blood pressure. So arterioles are so thin, and if you are putting more pressure into the arterioles, then what happens? It will break down. It will lose its structure. Once it is losing its structure and not able to exchange the waste product effectively, then what happens? That is the thing, we fail mainly because of high blood pressure and the diabetes, or you can say any other and mechanical injury that is there, that will not take into the. This is a nephron is the you can say sub part of the kidney. There are so many nephrons, millions of nephrons. Exactly the numbers, it varies, but it is huge in number. So collectively they operate, and some portion of that it is not working, rest will take care of your excretion. For that reason only, it is not realized at the initial level of the kidney problem. Okay. And there is this one is filtration. Blood enters into the nephron through the glomerulus, and where the portion of the plasma is filtered into the Bowman's capsule. It's called as a Bowman's capsule. And initially, this initial filtration contains the water, ion, glucose, waste product, and other substances which are not required to our body. It does it. Then there is a reabsorption also, there are so many useful things detected. Then that will recycle. There will be flows through the flows through the renal tubule, and essential substances such as glucose, water, electrolytes are reabsorbed back into the bloodstream to maintain homeostasis. Yes, we have already talked about homeostasis in the first introduction of our body. Homeostasis, the kidney is a main organ, which is very much required for the maintaining of our blood pressure. Without blood, do you think we survive? No. So, and it should be a correct pressure. I mean, standard, there should be like, 120, 170, 120, it varies as per the doctors and time to time. So, okay. So, likewise, it has got I have video on that also, how the regularization of the blood pressure is done through the kidney. Fantastic thing. Every organ has got a sensor. Like a heart has got a sensor, kidney has got a sensor. As soon as it senses something, suddenly it gives a signal. So that makes our body to run in a perfect way. Okay. Substances such as excess ions, waste product, and urea, creatinine are creatinine as a what is that creatinine? Creatinine is a waste product of a muscles when we work, or you can say that time creatinine is produced, that is excreted, and it should be within the limit. If it is more, that means it is within 1.2, it is again varies. If less than 2, it is good and fine. Okay, in this way. So, concentration of the urine. The loop of the endless plays is a crucial role in concentrating urine by establishing a concentration gradient to the surrounding kidney tissues, allowing water to be reabsorbed from the collecting duct. Okay. So this is basically what all there I'm just telling, and then there is another part of this is for the men is the prostate gland. This is a prostate gland, bladder. So what are the parts of actually urinary system? Let us see that kidneys and the ureter, urinary bladder, and this is called as a urinary bladder. So bladder full, they say no, bladder full, or you can say even for a prostate gland enlargement, they check the residual urine. With that, they assume because the residual should not be more. If it is nil, actually, if it is less, then there it stales. Then it makes the kidney, or you can say your UTI, urinary tract infection is what in this tract, and even cystitis. And when bladder has got some problem, or you can say in a bladderitis, they don't call. They call as a cystitis. Okay. So cystitis is a bladder infection. So like that. There is we'll study, and now itself we'll study because we may skip it later. There is a disease called the Bright disease. It's a common uh, disease at the beginning of any of the kidney failures. So it starts with the proteinuria, and how do you easily we can detect the proteinuria? Uh, Protein, protein is a foaming like material. It produces a foam, So when we pass the urine, if you find the foam in the urination and or pan, that you should check for the protein in the urine. That is called as a Bright disease, or you can say it is also called as a proteinuria. And that is the beginning of the kidney failure. And there is a test in the to test the kidney functioning as a kidney functioning test. In that one, everything mainly protein loss also is taken. And I already last session, I think you must have seen the my videos. There we are using a quantum analyzer because we as an energy healer can depend on and some no additional. We did not the sure shot know that one has got this problem, but still it will give a suggestive of that disease, and no kidneys and what protein and whether sugar is going very beautifully we can detect through the quantum analyzer. I think I'll share that video. Please go through that video. Even that is not the part of our the common session, but still, if someone is interested, will definitely. And I don't sell those quantum analyzer. Don't mistake me that Uh, please give me one like that. Don't tell me it is available in Amazon. If you get it from the Amazon, definitely I will help you how to use it for the energy healing. Okay. So Now let us start the some interesting videos, and we'll go once again the. I think it's already opened. We'll see it once again here. We will see just एक बार जैसे देख लेंगे, so that when you see that videos you will have that idea. There are so many problems comes. There is a shrinking of kidneys, you know. So this I have already given to you. You can go through even if you want to deep dive, but you should know that there are so many things, but the for treatment treatment side is the same for some for somebody. No, he can have only atopic kidney. Atopic kidney means only one kidney. So they have seen the patient like that. So these are all I already supplied to you. Just see, but these are not so important because we are only the yes, we want to catch this problem at the initial stage of the. Okay, and let us see. Yes, this one I have already given to you. So you can nephron how it looks, and we will see the actual the animation and class on also. This is the nephron, and see, that is what I was explaining. After the bladder, it passes through the prostate gland. Ureter that passes through the urethra, passes through the prostate gland. For that reason only, in men, what happens after the age of 45 or 50, it generally becomes the hypertrophied, means it will become enlarged. When is enlarged, it will press this tube from inside also. So for that reason, the frequent urination, what happens from here, signal goes as opposed to the brain, like bladder is full, you urinate. But what happens due to the residual urine here because of the prostate gland enlargement, the wrong signal comes to the goes to the brain. But when you try to urinate, but the complete urine is not passed out. So in such condition, we have a prostate mixture with you with us. We can add, and KBS is also one of the why bladder is also involved. Kidney of course we can. It is a generator of the main urine. So KBS if we give and plus the prostate gland, then it will help the to address this particular problem. Okay, this I already given you the. So I think from here only I have copy and pasted few of the pictures. What else is there now? And we'll come back. We'll come back after studying the anatomy, physiology, how it functions and all. We'll come back to our select your remedy and even darbari and our remedies and useful combination.
The urinary system does more than you might think. The obvious functions are excretory and urine formation, transport, storage, and release, but it does quite a lot more. Since it is a regulator of how much water is in the blood, it can impact blood pressure, but it can also stimulate blood cell formation. Vitamin D is made from the interaction of sunlight and your skin, but it gets activated to perform its hormone function by the kidney cells. Your blood must stay within a very narrow range of pH for critical chemical reactions to occur and to prevent damage to cells and tissues. The urinary system is vital in keeping the pH in proper balance. So as you see here in the list, 7 functions in total for the urinary system. Let's begin with the big picture view of the urinary system. It is comprised of the kidneys, ureter, bladder, and urethra. The right kidney is lower than the left kidney due to the liver being large. In a view from above, you can see that the digestive organs are in a separate cavity from the urinary system. The peritoneal cavity houses the digestive organs and has a serous membrane which secretes a small amount of fluid into the cavity that lubricates the organs so that they experience very little friction as they move about inside of the body. The kidneys are in the retroperitoneal cavity. Literally, that means behind the peritoneal cavity. Unlike the digestive organs, the kidneys are not allowed to move much when the body moves. They're held in place by pararenal fat. This fat firmly holds them in place. If someone gets too emaciated, the kidneys can slip, causing the ureter to get pinched. We will begin by examining the urinary system in depth with the kidneys. They are about the size of clenched fists. The outer covering of the kidney is the renal capsule. It's made up of fibrous connective tissue. The renal artery and the vein connect the kidney to the circulatory system. As blood enters the kidney, it is first taken to the nephron, which is housed partially in the cortex and partially in the medulla of the kidney. The medulla has an alternate name of renal pyramid, and at the tip of the renal pyramid is the renal papillae. The nephrons are the key functional units of the kidney. The materials removed from the blood are then dumped into the minor and major calyx, renal pelvis, and ureters to make its way to the bladder. One of the best analogies for kidney function is called the desk drawer analogy. Suppose you need to clean out a desk drawer. There are basically 2 ways you could do it. You could open the desk drawer and start picking out the stuff you need to get rid of. When you're done picking out the junk, everything left in the drawer is good and the drawer is clean. Alternatively, you could dump everything onto the top of the desk and then put the good stuff back into the drawer. That's how the kidneys clean the blood. Plasma is dumped into the nephron, and then the good stuff is pulled back into the blood vessels. The rest becomes urine. It does this in 4 steps. 1. Glomerular filtration. 2. Reabsorption. 3 is secretion, and 4 is reabsorption of the water. In some texts, step 2 and 4 are combined, but we'll handle them separately here. Let's look at each of these steps one by one in more detail. Step 1 is glomerular filtration. The name's a logical one since it happens primarily in the glomerulus, which is housed inside the Bowman's capsule. The Bowman's capsule is made up of a parietal layer of simple squamous epithelium. It opens into the proximal convoluted tubule. The glomerulus receives the blood by the afferent arteriole. Embedded in the arterial wall are granular cells, or another name for them is juxtaglomerular cells. These we're going to learn more about a bit later. There are holes in the glomerular capillaries. The holes are called fenestrae, and they make these capillaries more porous than other capillaries in the body. The glomerulus is a visceral layer composed of podocytes, which are specialized cells that actually attach to the glomerular capillaries by means of small processes called foot processes. The purpose of the design is to allow everything but the blood cells and proteins to leave the blood vessels. The liquid that has left the blood supply here is called filtrate, and it's essentially the same as interstitial fluid in composition. Notice that the afferent arteriole is considerably larger than the efferent arteriole. There are 2 reasons for that. One is that the blood supply leaving the glomerulus will have part of the volume removed due to the filtering, but the purpose is also to keep the pressure in the glomerulus high enough that the filtrate can leave the glomerulus efficiently. Average adults have 5 liters of blood, and the volume passes through the heart every minute. The blood flow to the kidneys is about 20% of that. So the renal blood flow rate coming through the glomerulus is about 1 liter of blood per minute, which is about 1/5 the total blood supply of your body. The amount of pressure inside the glomerulus is 55 millimeters mercury. There is a counter pressure too. Water tries to go back into the glomerulus because of osmosis. This is colloid osmotic pressure, and it amounts to about 30 millimeters of mercury pushing back in. There's also capsular pressure that comes from the walls of the Bowman capsule resisting overfilling by the filtrate. It runs about 15 millimeters mercury. Overall, then, the outward pressure sending the filtrate down the proximal tube is about 10 millimeters mercury. If the pressure gets out of balance, then renal shutdown is a very real possibility because the blood cannot be filtrated. Some possible causes of the pressure drop are hemorrhage or severe dehydration. We are now to step 2 of urine formation, reabsorption. Now, we will get a chance to see what's happening in the rest of the nephron. Before we get to the names of these new structures, we will get a big picture idea of what's happening here. There are 1.3 million nephrons in each kidney. To survive, you must have at least 1/3 of them functional. They are located in the cortex and the medulla of the
Yeah. It is the exact number is 1.3 million nephron in each kidney. So to survive, you must have at least 1/3 of that functional. Means that is the biggest problem. Biggest problem means we are unable to detect the kidney problem at the earlier stage. After only loss, failing many one more than 1/3 of that, then only we will come to know there is something wrong. So I will tell you there is one test also. With that we will be able to detect this kidney problems well before they are going to fail.
kidney. You have been introduced to the filtration system that occurs in the Bowman's capsule. The filtrate has a lot of substances in it, including things that you don't want to lose. In our desk drawer analogy, once you dump the whole drawer out, you now are to select what goes back into the drawer that you want to keep. This is absorption. Some of the good things that you want to return to the blood supply are water, sodium, and water-soluble vitamins. The reabsorption is going to occur in the remaining parts of the nephron, such as the loop of Henle. It's a section that narrows and loops back up in the medulla of the kidney. There's only about 10% of the nephrons in the kidney that have the loop of Henle. As the filtrate goes through the tubules and loop of the nephron, they pass close to the network of peritubular capillaries. These capillaries are what the nephron is trying to get the good stuff back to. Let's continue our filtrate's journey from the Bowman's capsule and glomerulus, which together are called the renal capsule. The walls of the nephron tubule are very thin. The one nearest the Bowman's capsule is the proximal tube. Proximal means close to. It's made up of simple cuboidal epithelium because there has to be room for cellular machinery to facilitate reabsorption. The cells have a brush border to increase surface area, much like the intestines have the villi. This increases the rate of absorption. Most of the reabsorption happens in the proximal tubule. 65% of the water and virtually 100% of the glucose will be absorbed to be returned to the peritubular capillaries from this structure. The loops of Henle is made up of simple squamous cells. It leads to the distal tubule, distal means far away, and the collecting ducts. When the filtrate enters the collecting tubule, then it's officially urine. There are 2 types of reabsorption, active and passive. The materials that must be actively absorbed are nutrients, amino acids, and glucose. These will not normally pass through the membranes of the nephron. To move these materials back into the blood supply, energy in the form of ATP must be expended and carriers must be used. Tubular maximus, or Tmax, is the maximum rate of reabsorption by active transport through the nephron tubules. This limit occurs because there are a finite number of carriers taking the materials out of the filtrate. The carrier's quantity is calibrated to what the body needs. If you need a lot of a substance, more carriers will be there to perform the job of getting the substance back into the blood supply. If you need only a little, then only a few carriers for that substance will be provided. You hit the Tmax when all the carriers are busy and some of the material then passes to become the urine without being reabsorbed. Sodium is usually in urine since we take in so much of it that we're usually at Tmax. If glucose levels are too high, you will spill glucose in the urine because it's at Tmax. The glomerulus isn't supposed to let proteins get through, but if a few proteins did slip through the filtration process, they will be returned to the blood supply through pinocytosis. Next, let's look at passive absorption. Substances that are passively absorbed move freely through the membranes because of differences in concentration. The proximal tubule will have internal and external concentrations that are about equal. The descending limb of the loop of Henle will have a filtrate that is of higher concentration than that of the fluids in the blood plasma. The ascending loop will have much of the filtrate substances removed, so the blood plasma now will have a higher concentration. The distal tubule will be in an area where the blood plasma will have higher concentration than the filtrate. Some of the substances that will be passively absorbed are water, urea, and chlorine ions. Some chemicals that have passed back into the blood we don't want there. They must be secreted back into the nephron to head to the urine. The desk drawer analogy helps us understand this. After adding things back into the desk drawer, you may have decided, I don't want this after all, and you put it back in the junk pile to be thrown away. You secrete it back to the junk pile. Step 4 is water reabsorption. Some sections of the nephron are permeable and others impermeable to water. These variations of permeability are essential to the control of water levels that return to the blood. In the distal tube and the descending loop of Henle, the membranes are permeable to water. The interstitial fluid in the kidneys here reach up to 4 times more concentrated than the rest of the body as you move toward the tip of the loop. This efficiently pulls the water out of the tubule and the loop and into the medulla. The vasa recta capillary in the medulla then reabsorb the water. The ascending limb of the loop of Henle is impermeable to water. Its job is to actively move electrolytes back into the blood flow. The distal tubule and the collecting duct vary their permeability based on ADH levels. ADH is produced in the hypothalamus in response to cell shrinkage. If the cells shrink, it's because the concentration in the blood plasma is too high so that the water in the cells move out toward the higher concentration. This cell shrinkage can damage the cell. It will be important to get more water into the plasma to reduce concentration there. The reverse can be the case as well, and the lack of ADH will slow the amount of water that continues to be absorbed in the distal tubule and the collecting duct. Transitional squamous epithelium line the bladder. With this, it allows the bladder to stretch without tearing, and it can go from the size of a thumb when it's empty to pretty good size whenever the bladder is full. Notice that there are 2 sphincters. One is involuntary and the other is voluntary. We have the automatic system even by the time we're babies. A full bladder results in an impulse to the spinal column, which then signals the internal sphincter to relax and allows the urine to flow. Myelination of the nervous system, so the spinal column can send a signal to the cerebral cortex, will then give us control of the voluntary valve called the external urinary sphincter. Before the myelination, it opens with the other sphincter automatically. As we age, we lose our nervous system control, and the system reverts back to the way it was when we were babies. This is called incontinence. When we listed the 7 functions of the urinary system, number 4 was blood pressure control. This is because the kidneys can regulate how much water is in the blood. The more water there is, the higher the blood pressure. You cannot just add water to the blood supply, though. If concentration doesn't stay balanced in the plasma, diffusion and osmosis will get messed up. So, with the water, you have to also control the solutes that go along with it into the blood. The afferent arteriole has juxtaglomerular cells, also called granular cells. These detect the blood sodium levels and blood pressure. Drops in either of these release renin. Renin is an enzyme that will activate angiotensin in the liver. Ogen means precursor, angio means blood vessel, and tensin means pressure. When the above two interact, a peptide called angiotensin 1 is produced, which interacts with enzymes in the lungs creating angiotensin 2. Angiotensin 2, 1 increases vasoconstriction powerfully, 2 makes you thirsty, 3 makes you want salt, And 4 releases aldosterol, which increases sodium reabsorption. More salt will cause more water to be retained and increase blood pressure. When volume is high, it stretches the atria, which triggers natriuretic hormone release. This hormone inhibits the nephrons from reabsorbing sodium, which lowers water levels, bringing blood pressure down. The last function we will discuss is pH control. Normal pH ranges from 7.35 to 7.45. That's a pretty narrow range to have to keep things in. This would be the pH of the blood, though, not the cells. Cells are a bit more acidic inside because of the carbon dioxide being produced. Notice it isn't even 7.0, which on the pH scale would be considered neutral. Neutral would actually not allow life to continue. If the blood becomes too acidic, acidosis occurs. This will decrease the nervous system's action, leading to coma and death. Alkalosis is when the blood pH increases to become more alkaline. It results in overexcitement of the nervous system, leading to convulsions. There are key pH changers that can occur. Vomiting can lead to alkalosis. Diarrhea can lead to acidosis. Kidney dysfunction could happen either way. If the kidneys get messed up, then blood pH can be all over the place. So how do we control pH? Well, the body has a buffer system. It's the least efficient, but it's quick. It includes buffers such as bicarbonate, phosphate, and there are a few proteins that help too. These are basically weak acids, weak bases. The respiratory system plays a part too. It's a bit slower, but it's more effective than what we have with the buffer system. The kidney secretion of hydrogen ions, the more of it we have, the more acidic you have, is the most effective, but it's the slowest. It lowers the pH of the blood and raises the pH of the urine.
So it is almost covered the all the topic of this kidney, and I have so many other this thing also. It could be a repetition, so I'll not do that. But what I was intending to do it physically, how it looks in our body. We have seen all this animation, and you can show in this one. I like this video too much, so I want to share that one with you. And physically we can say how much big it is. We'll be able to with that visualization, it will be very helpful. The regulation of the excretory we have already seen, means how the blood pressure is regulated, but they have shown it very shortly. But if you want to know it once again, I'll play this video. Otherwise I'll skip that. And okay, this one, before going to the anatomy and the physical is seeing that, we'll go to this video because
Alright, so I think we have a pretty decent appreciation of renal anatomy. We know how the kidney is structured. Now we just need to take a look at some of the finer details. We started talking about the nephron, which I kind of drew right here, and we said this is the function part of the nephron is called the glomerulus. So if we look here, I mean, there's holes,
yeah,
they're
almost
very
I think it is
holy.
covered.
And so because of
We'll
that,
not
the holes allow
we'll utilize our time very effectively, because in that one everything was covered. So we'll go this one. This I feel very much interesting. After that, I will tell you how we can become well before the kidney is getting failed.
In this video, we want to walk you through the anatomy of the urinary system. And of course, the urinary system includes the kidneys, the ureter, bladder, and urethra. So let's orient ourselves to the location of the kidney and what we see in this shot. So here is the view of the posterior abdominal wall while we have pushed all the intestinal loops to one side, to the right side. So here we have the inferior vena cava, we have the aorta, we have the left kidney. Okay? Now, in regards to the kidney actually is a bean-shaped organ located in the posterior abdominal wall. Then that is retroperitoneal organ. But as I mentioned, in this view, we have removed everything, so you don't see the peritoneum. Okay, in regards to the relationship of the kidney with the other structures, I'm going to lift the kidney and pull it to the right side and look at a muscular bed, which is made by several muscles that they make a bed for the kidney actually. So here is the fibers of the diaphragm. Then we have the transversus abdominis right here, if I push it like that. So you can see the fibers of the transversus abdominis muscle, which is arising from this whitish structure is known as thoracolumbar fascia. Okay? Then we have this muscle right here, that is quadratus lumborum muscle. And the last but not least here is the psoas major. This muscle is psoas major. So then the kidney actually has a relationship with these muscles. Also good to know that between the kidney and these muscles on the posterior abdominal wall, we have, or we can find some of the branches of lumbar plexus, such as subcostal and iliohypogastric and ilioinguinal. But in here we have a normal variation. We don't see both of the iliohypogastric and ilioinguinal nerve. So then the kidney actually is leaning on these nerves. Okay, let's go through the external feature of the kidney. Okay, since the kidney is bean shaped, so we are going to focus actually on two parts of the kidney. One is superior pole, which is right here, and as you can see on the medial side is occupied by the adrenal gland or suprarenal gland right there. That is the gland, which good to know is separated from kidney by layer of fascia. Then it has its own capsule and fascia. And then the medial border of the kidney, which is right here, and on the medial border there is a slit right there, which is known as renal hilum. The renal hilum gives passage to the structures which are going into the kidney or leaving the kidney, such as this big one here, renal vein. Then we have the renal artery right here. We also have another renal artery here. That is normal variation, is extra artery going to the kidney. And on the posterior side, we have the ureter right there. Okay, these are the structures, and also we lymph nodes that are associated with the renal hilum. And also good to know that each kidney is surrounded by layers of fat or connective tissue. So on this side, we have opened actually the layer of the fat here. So we have perirenal and pararenal fat with renal fascia separating these two. So, but practically in the dissection we cannot separate them. So it's just these two together. And as you can see, we can easily take the kidney out of that layer. In this shot, we want to walk you through the internal feature of the kidney. So as you recall, here is the hilum of the kidney, and here is the ureter right here. So we will open the kidney like a book, like here, and we look at inside. So in regards to the internal feature, we have three distinct areas. That pale area on the periphery is referred to as cortex. Then we have medullary part of the kidney, or just medulla, which is this area is filled or occupied by the pyramidal shaped structures known as renal pyramid right there. And then this area right here, which is a space, and I put the tip of my probe in the space, that referred to as renal sinus. The renal sinus is filled by the branches of the renal artery, tributaries of the renal vein, and also these structures, the tube-like structures that collect the urine. So we go with the name of this in a second. Now back to the cortex. As you can see, part of the cortex has invaginated and sitting between the renal pyramids. So this part is referred to as renal column. And one renal pyramid plus half of the renal column is referred to as renal lobe. Now, the base of the renal pyramid is facing to the renal cortex. However, the tip, which is right here, is pointed and is referred to as renal papilla. Renal papilla. Now, from the renal papilla, the urine, which is, by the way, is located inside the collecting tubules inside the renal pyramid, is drained to a cup-shaped structure known as minor calyx, which is right here. And some minor calyces join together and they form the major calyx. So that is major calyx right here. So if I can hold my probe right there, that is minor calyx. Then here is the major calyx. And two or sometimes three major calyces join together and they form this expanded part known as renal pelvis. Okay, then all these structures actually collect the urine from the renal pyramids, and then the urine is going to be drained from the renal pelvis into the ureter. Then ureter actually starts from the renal pelvis. Okay, when the ureter actually coming out of the renal hilum, so it travels on the posterior abdominal wall, okay, crosses with the psoas major, is actually in front of the psoas major, and good to know that ureter here crosses one of the branches of the lumbar plexus, that is genitofemoral nerve, okay, then passes over the pelvic rim, and it goes all the way down into the pelvis. Now, inside the pelvis for our orientation, that is pubic symphysis, then that is bladder. Then when it goes to the pelvis, it joins the bladder or enters the bladder. And then right here, it crosses the vas deferens. And this is rectum behind the bladder and the pouch right there between the bladder and the rectum. Okay, so we are looking at the female pelvis here. So for orientation again, here is the pubic symphysis. We have the bladder right here, the uterus, and the rectum down there on the posterior side. That is the rectum. Okay, so of course ureter coming from the posterior abdominal wall and joins the bladder, or actually enters the bladder. Let me just move that one here that you can see better right here. Now, when the ureter comes to the pelvis, it crosses with an artery here in female pelvis. That artery is uterine artery, and usually the mnemonic that we use is called the bridge over water. So the bridge is uterine artery and the water is ureter. Okay, now in regards to the internal feature of the bladder, so as you can see, the bladder has been opened here. Okay, so we are going to open that completely, and then we look at inside the bladder. So the mucous membrane of the bladder has actually folds all the way around the bladder or inside, except one area right here, which is a triangular shape. So I'm going to hold the pelvis like that you can see better. Perfect. Okay, so that triangle area is called trigon, the urinary trigon. So the corner of the or angles of the trigon is made by the entrance of the ureter, one here, one there, and down here is the opening of urethra. Okay, then urinary trigon is made or is located between these three openings. The mucous membrane here is smooth, whereas the rest of the bladder, as I said, it has folds. And good to know that from embryology, from the embryology perspective, that trigon is derived from mesoderm, whereas the rest of the bladder is derived from endoderm. Okay, let's look at the different parts of the bladder in the female pelvis. So first, we need to orient ourselves. Here is the pubic symphysis. That is bladder. Then the uterus on the back, vagina, and part of the rectum and anal canal from anterior to posterior. And we also have a section of the clitoris here and the urethra right there. This is urethra. Okay, when it comes to the different parts of the bladder, so let's zoom in here that we can see better, actually more close-up of the bladder. Thank you. Perfect, that's great. Okay, now the bladder actually has the superior surface right here, the apex, which is right there. That apex is attached to the umbilicus via a ligament, median umbilical ligament. It has the base right there and the neck. That neck surrounds the upper part of the urethra, and then inferolateral surfaces. So that's kind of the orientation of the bladder. It's like bended forward. So then also you can see better mucosal fold in this specimen inside the bladder. Okay. Then when it comes to the urethra, good to know that urethra is really short in female, almost 4 centimeters. That opens actually in the vestibule, that space, that area, that the space is between the labia minora. Okay, so the urethra and opening into the vestibule. Let's go with the bladder and different parts of the urethra in male pelvis. As always, we need to orient ourselves here. Here is the pubic symphysis, bladder behind the pubic symphysis, the prostate, the rectum and anal canal, and then the sacrum. So then it's from anterior to posterior. Okay, so in regards to the external feature of the bladder in male, we do have all the parts that we already look at in female pelvis, and also the relationship here, which is of course different in male pelvis. One is the relationship between the ureter and the structure in the pelvis. If I can hold it, the pelvis like that, thank you. So here is the ureter coming from the posterior abdominal wall, and then as you can see, it crosses with the structure here. That is vas deferens or ductus deferens. Then practically the mnemonic of bridge over water in male pelvis is ductus deferens or vas deferens that passes over the ureter. Okay? Now, when we follow the vas deferens posteriorly here, then the expanded part of the vas deferens, which is right here, this one, is ampulla of vas deferens, and then seminal vesicle. These two are associated with the base of the bladder here. Okay. Now let's go with different parts of the urethra. So if we can zoom in here, that we can see better a close-up of the urethra. So you can zoom in. Perfect, thank you. So I'm gonna move that specimen right here. Perfect. Okay, so the different parts of the urethra includes the parts which are passing through different organs. So this part of the urethra is called prostatic part of the urethra. As you can see, it passes through the prostate, and that is the most dilated part of the urethra. And the part before that is pre-prostatic part, which is right here, and that part is surrounded by the internal urethral sphincter. Okay, going down, this part of the urethra is the one that surrounded by the external urethral sphincter. Practically, that is the deep perineal pouch here. And the last part is the part that passes through penis, which is called penile or a spongy part of urethra. So then we follow that all the way down here. By the way, this is corpus spongiosum that urethra passes through. And then at the tip of the penis where we have the glans penis right there, urethra is expanded and it's called navicular fossa.
Thank you so much. How you enjoyed it? I every time I show this, I enjoy because yes, that the practical that animation helps us to understand it in the deeper level, but practically how does it appear in our body? It gives a more thrilling experience, you know. I think so. You also have enjoyed this now. Okay. Now coming back to the, I think we every part of the, there are many other videos, but in the main video we have covered all this topic. We'll spend time on the clinical part. I mean, the what are the diseases coming out, means caused by this, and which are the main. It's very interesting. And yes, one more thing I just wanted to tell you that how to detect it in the initial stage. EGFR is a test. EGFR is a test. We will be able to. I suggest now everyone should do it at least once in 6 months or once in a year at least. If they are below 30, 40 nowadays, that doesn't age is doesn't have a restriction for the diseases, can come at any time, but still EGFR is a wonderful test. So if EGFR rating is supposed to be more than 90, is that means it is functioning normal. If it is less than 90, these are the 90 to 60 is no, and above 90 is normal. So that is the, you can see that there is a path. You can understand that there is a problem going to come in next future, and this can be a very good measurement for after giving how they are responding, whether kidney is recovering or it is going deteriorating. So we will, by this we will come to know by this test. This is a very simple test. It's a blood test. So with that, the we can detect the kidney problem in the early stages. Okay, and here what are the actually remedies within our mixture volume 3. Soham mixture volume 3, that water balance, kidney, KBS 30, kidney balance, Soham kidney, Soham infection, because always the kidney subject to the infection, and circulation balance, blood 200, blood OM, and Soham circulation, OM 7, and endocrine balance. These are the generally helpful in the tackling the our through our the Vibrionic remedy. Now we will see this is the most important thing. Don't forget this because you want to test or you can say you have any doubt, go for this test so that well in advance you will be able to retrieve it back. And one of the most important thing is that sodium diet. I mean less sodium or you can say salt, common salt. You take less common salt, more life will be there for a kidney. If someone is suffering from the low GFR, the like 15 to 60 and all, already 15 means it's already gone, kidney failure condition. In such condition, they must stop the common salt. Okay, now let us go to the selective remedy because this should be our first choice always, as I told you. After our KBS, kidney balance, OM kidney, and SOHAM kidney, and circulation, because if we have a good circulation, then only kidney will work. So, circulation balance and blood. If at all there is a problem in blood itself, OM blood, anemia, all these are the which will make the kidney healthy. Okay. So now we see what are the problems arising from the kidney and how can we tackle it. There is a Bacillus coli infection because it will be you will get it through the sooner you get the burning urination or you can say frequent urination, and when you give your urine for testing, that time you can find this. When you find that time the thuja and formica rupa only, and again I am telling you this selective remedy, they are giving the remedies based on the probability of cure. So when someone is coming with a Bacillus coli infection, that time Thuja will be the most specific for B. coli infection in of the urine. Give in 1M potency. The goodness of this book is also it gives you the potency. What potency you should use. If no potency is mentioned, that is to be understood as 30 potency. Okay. And next problem is bright disease. We saw the bright disease. What are the main bright disease symptoms? Of course, there will be a swelling. For that only I have pasted this. Bright disease is protein hematuria, bleeding, or you can say when in the initial stage you get the red blood cells in the urine and albumin. They know albumin is also called as a protein. They can the plus they add it. It is measured in terms of 1 plus 2 plus and like that. So and RBC cast. Cast means that is a you can understand this is a generally this also available when someone is having the urinary tract infection. Okay. So now the what are the main so generally in this way in the initial inflammation and this one there will be a fever also. So when and even kidneys as per the TCM it is the water element, and when you brought the bright disease is brought by the cold or sudden expression to the suppression of the perspiration, or when you are going into the cold condition when you can say, or sometime it happens even when you are sleeping, you are not aware and you are sleeping, and the fan is on, and then morning time it suddenly gets cold. In such condition, not only the kidney problem, any problem it comes, we have already discussed in previous, uh, that aconite is it helps like anything. Aconite is a thing where a disease comes in the form of storm suddenly. Abhi to theek tha, suddenly ho gaya. Like that, We will discuss some of the homeopathic remedies. So in that one, you will understand the importance of this. That is going to be one of our class, so that you will understand most important remedies, and you can make those things through our vibrionics and give. Okay, Apis mellifica. Many times I told you the Apis mellifica. What is the Apis mellifica? Law of cure. Law of cure says that whatever has created such problem will cure the similar problem. Law of similar. So Apis mellifica is a honey bee sting, poison. Honeybee, what is suppose honeybee stings you, yeah, bites you. What are the symptoms you are going to have? Red, heat, and sometime if it is more, then there is a urine infection like symptom. You can't pass the urine. There are so many things happening. How we came to know? Because there is in the Apis mellifica, you go to the remedy, and now it shows what all the problem it is facing in the urination. So let us read this. In case of bright disease, the thirstlessness, yes, thirstlessness is the main catching symptom of the Apis mellifica. And in dropsy, edema, swelling of the face and extremities, pain in the head, and also in the kidney, urination frequent but scanty. Yes, and urine heavily charged with albumin. I told you albumin, how to identify. If you are passing the foam along with the urination, you can suspect. Feeling of suffocation and breathing difficulty, these are the next level of the symptoms. So you can aconite and the Apis mellifica, they are main important remedies, and hellebores, dropsy due to the inflammation of the kidney. And I'm telling you, whenever you come across such problem, you first land into the select your remedy and try to identify, is there any symptom in your patient, and if they are showing some symptom, go to the depth. How to go to the depth? Go to the material, I mean that pocket manual of Materia Medica, then try to the can match the other symptom of the same remedy. If it you are getting is supposed to be in homeopathy, they say it tripod principle. If it is three things are matching, three symptoms are matching from one remedy, you can definitely give that remedy. So next one is, of course, you can use the pendulum to hold a hands of the patient, then operate the pendulum like so. Because we are all energy healer and we are not using the original homeopathic remedy, hold the hand and put on this remedy. Is it suitable for him? If yes, then go to the Materia Medica, or you can say any Materia Medica and confirm it with the other symptom. When it is confirmed with other symptoms, you can definitely give it in the vibronic form. Okay, that time you can give other remedies. How I do it? I give KBS and OM kidney and Soham kidney and all I gave in one bottle. The single remedy I gave in another bottle, because single remedy always works far better and very quick. So you can give in that way. So you by system you have to use it. One, you are using the general volume 3, you are mixing in one remedy, and you are giving the single remedy in this one remedy either in the globule form or the liquid form. Okay, and cannabis indica. So stoppage of urinary duct by pus and mucus, urine turbid and reddish, emission drop by drop, stitches and burning in urethra. These are all very horrible condition. If someone comes to you, I already advise you, play very safe in your profession. Don't take risk, because if they are already under some observation and treatment, along with that, definitely you can use this. And till the time they are approaching going to the doctor, you can give as a first aid and spiritual support. Most of the time they will come and tell you, sir, whatever you gave, it gave us a very good result and we didn't go to the doctor. That is there left to them. But you should always no advise them to approach to the regular doctor in case there is any problem. Okay, we will be working in support to the mainstream science. We will at present we will not replace the mainstream science. Let government tell us, oh, you can do it, and you can do it if you are as an independent what you call healing system. Okay, many things are there. Calichlor. Calichlor is the violent nephritis with a scanty and dark albuminous urine containing. These are all the last stage of kidney failure. You will get all these things. But always use a pendulum and match with the materia medica for your help, or you can say demo purpose. I will use one of the remedy like a calichlor. Calichlor is the violent nephritis and the scanty dark albuminous urine containing cast. Let us see if this particular remedy in depth. So likewise, you have to do it in the depth and to find out. And the match the symptom. If it is matches, then you can give in the starting with the 30 potency, or some potency is mentioned here, but we follow the selective remedy by Vishwambar Das. Because even that Vishwambar Das book was written before the IJK, before the homeopathy could be recognized as a mainstream science. Before that, so it was written for basically for a lay practitioner. Those are who want to help, and it was distributed. That once that book was distributed free of cost, means it has a lot of social cause behind it, behind that book, and not because they did not been written for the money sake. IJK Caliclorum, na JK. So this is how you have to go. I think our Sri Ram and other people, they have purchased this book also. You can purchase this book from if it is in Bangalore online also, it is available. So like that we have to check, because it is not searchable. For that reason I am because it is without having the copyright. For that reason I am using this. You should also match this. Caliclorinum is used for the albuminous, scanty, suppressed, hematuria and diuresis. Diuresis means the difficulty in urination. So it is we gone to the selective remedy and we come from here. and try to match with the other symptom, whether someone has the discolored, or can say what you call itching on papular eruptions, or you can say itching along with the itching, and that is even it happens at the last stage of kidney failure also. And albuminous, scanty, suppressed, and hematuria and diuresis, these are the symptom. Along with this, you match. Is there any feeling of weight in epigastric region? And if there is any flatulence, omitting of the greenish black matter, if that like that it is there, you can be pakka sure that yes, it is a matching to that particular symptom. Profuse secretion of the acid saliva, whole mucous surface red, turbid, and with the gray based ulcers, tongue swollen. So likewise, I gave the example from here where we come from the calichlor. If it is matching, because I have not taken the example of arsenic alba because it is a polycrest. Polycrest remedies has got all the most of the symptoms are all there in that remedy, and everybody feel that it suits to me. ये पक्का मेरे को सूट हो रहा है ऐसा लगेगा. But that is the first stage of the homeopathic study. At the first stage of homeopathy study, you study any remedy. You feel that it is perfectly designed for me. That is that if you start thinking like that, that means you are in the first stage of learning. Okay. Then how you should be able to distinguish between the other remedy and this remedy. And the most beautiful way for energy healer to decide is by using the pendulum. Pendulum can be anything. You use a rudraksha, or even a keychain also can be used. There is no any special thing. And whatever the pendulum you use, you love it, and you make a friendship with that. And how to tame the pendulum, how to use the pendulum, I have the video on that in my prabhakar.torvi is YouTube channel. You learn there and try to use it as many times as possible. Okay. And these are all, I think so we should skip to the next disease because all are very, very important. I was telling you, I was earlier thinking of taking 3 or 4 remedies in each disease, but I found that remedies are so interesting and they are so useful. I started going through all the remedies. Now, calculus renal and then stones in the urinary tract. So stones in the urinary tract. The Barbaris vulgaris is a head remedy. Barbaris vulgaris is a head remedy, and in when we talk, I think so we have not covered the electrohomeopathy. When I say about that, we will. Otherwise, if I already told you, we will revise once again because there is a definite. I think it is S5 and S6 and C2. These 3 are mainly used for the urinary problem and even kidney problem also, or kidney stones also. Berberis vulgaris is the head of the remedy, especially in the pain left side and extend to the kidney and urethra. With a similar symptom, it is also cures the pain in the pain right side. Osimum can. Osimum is one of the tulsi. The Osimum sanctum is the regular tulsi, and this is the Osimum can is also like is also a tulsi family. Okay, so lycopodium is also most important remedy in the stone. As I told you, then I have already derived the rate for the some adult combinations. So let us see in this one kidney prostate enlargement, kidney stones. Adel number 22 is addressing our adult 22 is cystitis, frequent urination and smelling urine, burning, kidney stones, all this is there, and what they are adding into their that combination. What is they are adding? Acid benzoicum, acid nitricum, apis mellifica, berberis vulgaris, colchicum, Cucus cacti, solidago, and Capsula bursa pastoris. And even not only that, even hematuria also it is they are using it. So they are making the combination as a broadband spectrum. So even any other problem also kidneys that should be addressed with this combination. So you can think and just refer my website. In that one, Adderley 22 means I have made a similar combination in our this one and take the radionic rate. Okay. So you can think. So what all the reason it is using, you can just go through. I told you, wherever you go to the homeopathic shop, visit homeopathic shop, not for buying the remedy. You collect the books which are kept on the table. That is, those are free, and try to correlate with the disease and the remedies, and come to this pocket manual of materia medica and read why they are added into those combination. Whether they are sometimes they are telling lies also. So in that one, ignore it and see whatever you can learn from the disease versus the remedies. And sarsaparilla is one of the most leading indicated remedy. Now, white sediment, urine becomes turbid like clay, water immediately after passing, much pain in the end of the urination, urine scanty and slim and flaky, tenesmus in the bladder. This is a fantastic thing. And in this case, what we give in our Narayani mixture? Ultimate KBS, kidney, bladder, and stone. Name is the shortcut. They have made it a KBS. So this case, first thing you should give is tell them to drink good amount of water unless until their kidney is kidney readings and creatinine readings are high. Urea readings are high. That means for them they do the water restriction so that to reduce the load on the kidneys. So if it is not that, if they are having all kidneys are healthy but they have stone, such situation will be there. In that case, you should give the KBS and along with enough water. So sufficiently if they take the water, and sometime the stones comes automatically. Also for giving this KBS, and there are so many other things, vegetables they are used help in dissolving the kidney stones, like the banana stem. Banana stem is one of the like a folk remedies in Karnataka that is used for make a vegetable, or you can say make a sabji out of that and eat that supposed to, or you can believe to reduce the kidney stones, and avoid tomato and so many rich in the iron content, palak, till the time if you have the tendency of making stone. And when you use our remedy, it will definitely reduce the tendency of making stone. Okay, then at the same time, we will study the Darbari also. What our Darbari says. Darbari is a biochemic combination book. We frequently refer this because the results are very excellent. So you can suppression of urine and all are there. urine to increase quantity. When you want to increase the quantity of urine, when like when there is any swelling and other thing, and in our numerical, I mean uh, volume 3, what that mixture, or you can say medicine we use, that is the water balance. Water balance is used for the balancing the water level in the body. So here you also you can give additionally. I told, if you are using the biochemic system, give it separately, and okay, or Vibrionics, uh, pure Vibrionics in the form of the Narayani mixture, give it separately like that. Tell them to take in this one. Okay, and we'll see. Very important thing is there, there is a that frequent formation of the stones. Okay, this is urinary stones are very easily we can be excreted, and yes, to remove the dissolve the stone. This is for the gallstone. Kidney stones. Yes, kidney stone. If I will come to know when there is a pain in the kidney, you go for the scanning. That time you will understand that there's a stone in the kidney. So in such cases, only they do the laser therapy, and for removing that, and many people are not comfortable with the laser therapy. That time the NM3X, NS3X, and Silicea 12X all combined in one remedy. You can make through the either using cards, or you can using the dial setting. You can give this for the long, as our vibronic support. And Silicea 12X is that can be given for the as a remedy for stopping reformation. That was there in the gallstones also. Like that, it is what is the Silicea? A silica. A silica is a sand. So if you give the sand, it will prevent the sand formation. So that is law of cure. Like, like cure likes principle. So in that one, you can give this combination, and along with that, Silicea 12X can be given. Okay. And now coming back to is there anything else? Lastly, we come back to our remedies and useful combination. Okay. Because we take it as a last. Cystitis. Cystitis, what I already told you, cystitis is the inflammation of bladder. Again, the symptom will be, like we have seen horrible symptom of the cystitis. It looks exactly like a malaria. Lot of shivering will be there. That UTI. Many people, those who are coming across or suffering UTI, they know that there is a horrible chill, and without fever generally. Very rarely we can find the fever in the UTI chills. So you can understand in that cases, if you go through the urine test, you will find out what is the problem in the urine. You can adjust to this. Aconite, see, there are so many things. The same is used for the other complaint. So for that reason only, we should concentrate on the symptom, not on the what it is. So Apis again, you see this again second highest also is coming under the cystitis. So even nephritis also, it is also coming under a top list only. Cantheresis, yes, the one of the most the frequently used combination for the kidney stones in homeopathy is, that is Berberis vulgaris Q and Cantheresis Q. 10 drops 3 times a day, we will eliminate the kidney stones. And how you do in the Vibrionics? Your Q potency is made with a completely clockwise direction. I mean, completely anti-clockwise direction. Set your remedy to 0. If 0 potency means it is Q potency. So you can give Cantheresis and Berberis vulgaris. They are most wonderful remedies for a cystitis and kidney stones also. There are hydronephrosis. So the collection of water in the, or correction of urine in the pelvic kidney from the obstructed outflow. If there is a ureter is obstructed with because of urethritis, I mean the cystitis, or in say the inflammation of the ureter, that time it can produce the back pressure to the kidney. In such cases, these are the head remedies. Uremia, again we saw about the bright disease. What happens? Retention of urine, retention of some harmful substance in the blood, which is normally secreted by the kidney, causing suppression of the urine, convulsion and coma. Okay, that can be uremia, can be acute and as well as the chronic also. The Belladonna, acute uremia, full blooded with a healthy patient when kidney ceases to function and urine becomes a dark and turbid, and it is a acute condition. Let us take the burning urination. This is common, UTI we are going to get an effect. How in our Vibrionic, how we are going to tackle this? Bladder, like kidney and bladder, or kidney combinations we can use, like KBS and Soham kidney. And along with that, we have to add the Soham infection. If you add Soham infection, because everything is there in the infection combination of the Soham. What is there? Var is there, panmycin is there, everything is there. So both together, it will reduce the infection of the anywhere in the tract. So it will give you a relief. So urination, burning, cantheresis is one of the most important remedy in the burning urination. And also I told you this is very good for even stones also. Staphylococcus aureus, burning urethra when not suffering, and burning stops while urinating. See, these are the symptoms. How they come to know about this symptom? This was produced in the healthy human being. When there is no passing of urination, that time burning is there. When they pass the urination, that burning stops. That is the symptom of Staphylococcus aureus. And Staphylococcus aureus, one of the another symptom is it is used after any operation. After operation, if urination is not passing, you can help in many ways. You can, no need to give the remedies only. You take their photograph and put into the output, and just transmit the Staphylococcus in case they are approaching you. So in this way, you can give the remote help. Okay, so we finally they and doctor has to tell us that whatever you are doing, it is helping. Please continue. In many times, we have had this feedback from the very good doctors or the doctors who thinks about the welfare of the patient. They say you are see in our therapy in our therapy we will not be able to get such a good result. You whatever therapy you are following, you follow. They will tell. Good doctors will tell. So okay. So that time you are in the good books of the doctors also. Desire for urination, constant desire for scanty urination, not attended to if gives feeling of congestion to the chest. So yes, there is one more equisetum, constant urination, pain in the bladder, as if too full, not relieved by urination. The equisetum is one of the ingredient of the C2 remedy. What is C2? Canceroso 2, they have added this in the electrohomeopathy. They have added this remedy. So, in case of you can see scanty urine and urination and painful urination, you can also use the electrohomeopathy C2, and we have already circulated those numbers. We have even Nada Brahma code also and even radionic rate also. You can make by them, and some of the electrohomeopaths they are expressed their great surprise that our rates are working excellently as it is mentioned. Like all our 38 combinations are there. All 38 combination we have derived the rate basic 38, and all mixed together it comes around 60. Okay, so we will tell once again. If I think so, I have not talked about the electrohomeopathy. Definitely we will tell, because we are going to complete our anatomy and physiology along with the remedy classes. Okay, then yes, petroleum. See, I think so. Someone has copied from someone, that is for sure. So petroleum is urgent desire to urinate. It may escape if not attended to quickly. This is available in the C2 again. Petroleum and equisetum both are the remedies which are there in the C2, which is making the blood. I mean, it is for a urination. Urinating problem, urination problem, or kidney problem, or you can say basically ureter, where urgency of urination, burning urination, what we saw in the equisetum earlier. See how they have expressed their remarks. Wonderful remedy in the cystic irritation of the old men. Constant teasing, desire to urinate with a little or no relief thereafter. Excellent remedy for chronic cystitis. Fantastic. So you can remember, if someone is suffering from burning urination or cystitis, you can choose the C2 from electrohomeopathy. Okay. Yes. We saw that already. Dysuria is one of the remedy which was there, which was mentioned in the caliclorum. So these are the head remedies. Head remedies means, see, with this, if you give it, definitely it is going to help. If they are feeling like this similar condition comes when you are you are obstructed with a stone. If because of a stone stuck somewhere in the ureter or the urethra, you will get a horrible pain and burning, and urine will not pass. In such condition, cantharesis is a head of the remedy. And I'm telling you, you only concentrate on first or two or three remedies. I again repeatedly telling you, otherwise you will get confused. You come to one point, you come to that particular disease, use first remedy. Don't, like, we are having the habit of adding more than one, two, three, four, as we mentioned in our all the numerical mathematica, or you can say CC combos, Brahmand. There is 50, 60 remedies are mixed. But in this case, you try to use only one and give it separately if you want to combine with the our CC combos or Narani mixture. What next? Involuntary urination and bedwetting. See, recently I have given, there is a combination, the child is around 9 years old and he has a still habit of urinating in the bed. Bed called the bedwetting. So I gave the bedwetting this one, and the another I made it in a pill, and from the numerical mathematica there is a bedwetting that has set into 10m potency in the reverse mode, because I want to reduce that habit. So that mother of that patient given a very good feedback that the pills are going to be over, and our son think, they generally don't say, no, he is cured like that. They say he's responding very well. So we want that only, someone should respond very well. They should reduce their problem, and they, ask for the next or the follow-up remedies, and they give the good feedback also. So causticum is one of the wonderful remedy for not able to control or involuntary urination. And in such cases, which remedy we have to follow in our numerical metric? The volume 3 Vibrionic book, that is CB7. CB7 is a wonderful remedy for the first stage of having control over anything. Urination control, you want to get the control on the urination, how you do it? You can give even bedwetting, and even sometime you can give the KBS also. Along with that, you give the CB7. When you give CB7, KBS and bedwetting, that time it will have a control over the bladder. So like that you have to, and CB7, how I came to know that the CB7 helps in this case. You go to the CB7, causticum is one of the remedy. So first study what you have to do, CB7, why it is working, where it is working, how we should come to know? By going through its ingredient. If 4 ingredients are there, then you read, and the one of the catching symptom, or you can say guiding symptom in the causticum is there. Generally, the elder mothers, they elder ladies or mothers, they are mother in the sense, that level I'm giving, don't think that you should have a kid, a small kid, no. Elder sisters, or you can say if they are having this symptom, if whenever they are coughing, or you can say sneezing, if the urine is just spilled out, it is a common symptom of causticum. It is written here. When they are blowing the nose during the night or cold, during the coughing, the laughing, sneezing, were from cold, paralysis of the bladder affecting the muscles of the expulsion, resulting in the retention of the urine and of the splinter vesicle, which causes the involuntary urination, not even feeling that the stream of urine is passing. Even though जो जा रहा है वो भी पता नहीं चलेगा उनको. Like that, in that cases, suddenly they have noticed that yes, while coughing and sneezing and this thing, urine is just that spilled out, or you can say drops comes out without the control. So that is the time we are use the causticum, and in our the volume 3 we can use the CB7. Okay, and gelsemium is another one that is also for generally these remedies are used for the lack of muscular control, muscle control. Bedwetting is a in the patient suffering from headache. It cures bedwetting when causticum fails. That's what this book again and again I am telling you.
ಬೇಡ ಅರೆ ನೀವು ಕ್ಲೀನ್ ಅಪ್ ಮಾಡಿ
So the causticum is the one of the leading remedy when you want to leading remedy when you want to use on the involuntary unconsciously passing the urine while coughing and sneezing. And another most important one is the gelsemium. Gelsemium is it is a bedwetting in the patient suffering from headache and cures a bedwetting when causticum fails. So that's why in this book the first thing is you should give the first remedy, or you use the pendulum and see whether you can check and go back to the pocket materia medica and confirm it, and then you can give. Or you search for the remedy, which remedy has got this which mixture has got this remedy, causticum. Like I remember it is a CB7, so you can give that way. And pulsatilla. Urine escapes in the first part of the night, especially in the heart patient, involuntary coughing, gentle and changeable disposition, craves to the go to open air, dislikes fats, and wetting in the bed following the measles. See, pulsatilla is a female remedy. So, and pulsatilla even helps in the stage of menopause. Okay, so yeah, in such condition when you're coughing and sneezing, if you're if it is a involuntary emission of the urine is there, that time you can think about pulsatilla in case of women. And CPR involuntary urination in the yellow sicky girl, specific for wetting the bed and the first step, especially is suitable for the girls, small girls, I can say small kids, that is, you can say girl kid, you can use this CPR, and it is most oftenly helps the patient. So restox, brainia, you can think about all these things one by one. Let us go to the next complaint. See, there is frequent urination. Argentum nitricum, I tell you, you go 1 or 2 remedies only, rest you don't worry. Frequent urination, someone comes you with a complaint of frequent urination, argentum nitricum only. How you have to produce this argentum nitricum? Either by the card or by using the dial machine. You can do that. Hematuria, blood in the urine. So generally, I have seen, parents come with a complaint that, my child started, there is a blood in the urine. That is the one funniest thing is that they don't understand that what vegetable they have taken the previous day. So if they are taking the beetroot next day, I know they are going to pass the reddish urine is common. So, but they don't think that way because they are very scared about their health. So they suddenly come to us and say, my urination was reddish, and because they heard of someone is passing that and they are going into the kidney failure, they all hear such a bad news and they try to imagine on themselves. So okay, that in such cases you first ask, have they taken the beetroot in the previous day? If it is yes, try to, okay, then you come another day, don't take anything and come, you can think. Otherwise, the best way is for a urine test. Urine test, they give the red blood, RBCs present or not present, they will be very easily, they will come to know. And one of the most important remedy is phosphorus. And many patient at the beginning of the problem, they get that cured with this problem. That is, the what is the phosphorus patient, how they look lean and thin, neat. And I will show one of my book with the picture itself, we will come to know what is the remedy for this, what is the remedy for this structure. And like even Naxomica also. If someone comes to you because uh, there are different type of patient we are with, someone is from the sulfur, they keep spread many things around. No, they don't keep it neatly. But when a patient comes and try to arrange your bottles neatly, है ना, that means the patient belongs to arsenic alba or phosphorus or Naxomica. Like that, with that behavior, or someone is coming and sitting and they're shaking their leg. That means that person belongs to zinc metallicum. So likewise, we can think about just by their appearance. We will study it in our next session, how to identify the remedies just by their gesture. Okay. And here in this case, hematuria, second most important remedy is this the phosphorus. But after you confirming that only, this fantastic one, you are going to, if it is coming to you, definitely you are going to cure such cases with the first four remedies like terbinthina, phosphorus, chininum sulf, and hemamalis. And even arnica, thalapsy, bursa, pastoris, and onsimum. They are excellent. If you don't understand, mix and give, don't worry. Here it is, they are going to help in their own way. Now, and use the pendulum. See, check whether can I add this into this combination. If yes, and decide out of whole list, I am going to put four remedies. So most important four remedies, and you also uh, confirm if you add this and this, is it going to increase the vitality or decrease the vitality? Because most of you are having the analyzer button. In analyzer button, what you can say is, if these two are combined together, will it increase the vitality of this particular person? Like that you have to, because like that you have to confirm the combination, not blindly. But if you are one or two remedies, if you're giving on the top, or you can alternate the remedies. Instead of giving all together, you can give, like a next is cystitis or okay, retention, incontinence or retention or suppression. It is already covered under the some other. Dysuria also we covered, I don't know, polyuria, uh, excessive excessive urination. So Naxomica is due to indigestion, and uranium nitricum profuse urination, and in dyspepsia along with the indigestion and stricture of the urethra. This is the most common problem, and where it is not tackled by mainstream science. Mainstream people, they are they don't have so good success in other than the surgical intervention. In such cases, we can definitely use this clematis, silician, graphitis, and what is the stricture? Urethra, that pipe we saw in our the practical the dissection in this video, that if it becomes thick and there is a narrowing of that passage, it is called as a stricture of urethra and even ureter. It is a common problem. So in such cases, these can be given, and if it is neglected, may lead to the kidney problems also. Okay, albinous, black urethra, I mean black urination. These are not, we are not going to have this, but you should understand why the black. Black means colchicum. Colchicum means colchicum is also one of the most leading remedy in the nephritis, inflammation of the kidney. You can think about it, because when you have to decide, because that is going to come not today or tomorrow or some other tomorrow. The people will come to you with such a problem with a lot of confidence that, yeah, I know, Mr. Torvi, you can do it for me. I know you have to do it. Then that time what you have to do, we have to see all those things, and they have the limitation, the other stream science, they have a limitation in the healing this. That time you can give the as a spiritual support, or you can say vibrionic support. Urine brown, these are all kidney problems only. Greenish is, if it is greenish color, carbolic acid and thing is a chelidonium. When it is with the liver. So these are the, and milky white. This is I have observed in my practice, and it was helped by using acid phos and the phosphorus, and this is also there might be many disease nomenclature or label, but you have to see what is the symptom of that complaint. I think we are running out of our time, but anyway, oily, what is the oily? Hypersulf and coca phosphates, red, scanty, we all have covered over there. And sediments is there. They will all come to know. With this, there are very good approach. And I can say that, in homeopathy and Vibrionics homeopathy, we have a lot of scope. Okay, that's it. And now the last one where we can find our this thing is remedies and useful combinations. And so the kidney, along with that, in the kidney chapter only, adrenal glands also they are used, because that adrenal gland we saw in our dissection the class, the previous video, it is placed over the kidney. So in that one, we are covering along with the kidney chapter only. So albuminuria, I told you that, if the protein is passing, and bladder infection, bladder you are saying where is that? Just above the prostate gland. And if it is there, and if it is in case of the female, you use the female balance, or in case of male, you use a male balance. Okay. So like that bright disease, we have seen what are the symptoms of the bright disease, and excess fluid in the kidney fluid. With that, this is a diuretic. Diuretic is what? If you find, in allopathy, they use the ditor and so many things to activate the kidney. Here we can use as a spiritual support or vibronic support, you can use KBS and natrum sulf and apis mellifica. Apis mellifica is what I told you again and again. This is the why I am telling you that you should remember the source of this remedy. Apis mellifica is the honey bees sting, honeybee poison. What it does, if someone is bitten with a honeybee, what happens? Completely face swelling and thirstlessness, reddishness. So similar thing, if you can find in sometime you find it in the knees, or you can say some other parts like that, you should think about the apis mellifica. And in case of excess fluid in the body, we can use this to make more urine, create more urine, and to reduce the water content in the body. Gout, it is definitely comes under the rheumatic problem also, but uric acid level is increases in the in our body. So with that, when that great toe, great toe side, it becomes swelling, and during that time it will be very painful and all. That is a combination. So it is a kidney, you will not able to process the because improper function of the kidney, uric acid is secreted more. That uric acid goes and sit into that joints and makes you joint painful. That is a story of the gout. You can use this combination. And hematuria and kidney failure. And you can use the CC combos also. You know what all the CC combos can be used in this case. All 13.1, 2, 3, 4, 13 series are useful for the kidneys and the bladder. So kidney stones to dissolve. Barbaris vulgaris single remedies also written, divine protection, and go through this cantharisis as I told you. Cantharisis and even gallbladder stones also they are included in this. Kidney single remedy, SR kidney. SR is what? Is a single remedy, and we have, if someone is not having the card, there is a conversion rate. You ask me, I will give you. Because if everybody is having this cards, you can just go to the card number 501 and they will get that kidney. And those, when you insert in the machine, you get the energy remedy for the kidneys. Pain and urinary tract, general infection, war, acidity and kidney and all, apis mellifica again, and gunpowder, and these are already there. If instead you can use all the kidney remedy along with the Soham infection. Urination, bedwetting. Okay, this is the incontinent of that. So I told you, whatever I told you, that only they have written here. You see, CB7, NM21 KBS, and benzoic acid, medorinum 1M, 1 dose every 2 weeks. Because they have found out that this is the poison behind, a miasm behind this bedwetting or incontinence. Okay. Means not able to control the urination. Sometime it happens so. Involuntary on coughing, causticum, calicarb, and the CB7. We already discussed that. And sphincter muscles paralysis. That is what, they are not able to control the urination. That is called. And for that, involuntary, suddenly before, you don't feel only. They don't feel that they are passing the urination and urine goes away. That in that condition, we can use this. And water retention. Water retention is a very, very important remedy, because water retention happens in many cases. No, like the in case of kidney failure, in case of the water accumulation happens, and in case of liver failure, also the acidic things accumulates in our body. There are so many reasons water accumulates in our body to drain this out. That this is a common remedy that can be given. Someone is there in the some allopathic or homeopathic or some Ayurvedic treatment, and if they come to you, see, can you help me in this case? In that case, what if water retention is there, and we can pull on. It doesn't mean that we make them perfectly all right. Very rarely people get all right, but we can give them the extension of life. I saw because. Uh, in the last stage of cancer, people come to us in that one to get the spiritual healing, or can say supportive remedy, and most of the time backup nutrition and uplift gave the very good. They pulled their life 6 months more, and they were comfortable till they die. So of course, we now we understand with our present the knowledge and the experience, because we are all called as a vibronic practitioner or a practitioner, means we practice every day. With the practice, we gain the knowledge, we gain the experience. So with our experience now, now we are able to give very good, very nice support to the cancer patients. And see here in our group now presently, our doctor, our Mr. Dhananjay is there. He is helping a lot in the case of the uh, in case of cancer support. They are doing very well. They are feeling better, and he has circulated that thing in our group also. We are very happy to, and definitely people will ask. No, when people will ask you, can you cure the cancer? Then definitely say no, because it is a challenge to the medical world. So if you say I'm no getting the result in the cancer, they scare you. Instead, you can say the patient themselves, they can show that, they can say that after going through these remedies, my life has become comfortable. That's a very good way of like that only. In advertisement we get, हाँ मेरा घुटना ठीक हो गया, आप भी ले लो, डॉक्टर आर्थो ले लो, like that they say. They don't directly, they say that this cures this, because that is a ethics in medical advertising. There is a ethic of medical advertising. Never say I do it. You can show the people. See, this fellow had the cancer. They felt better, and these people were having the cancer, or they are feeling better. Or one of our case, we could extend their life for 6 months more, because they are totally bedridden. Their life become little bit better. They started feeling hungry, and they started doing their work. Then ultimately, and one day they have to die, and everybody has to die one day. So like that, till the time, what is our ambition? Till the time people we come to an end, we should be healthy and happy. That is our main motto. Okay. Now with this, I think so. Is there anything else I left? Darbari renal system, and okay, this is how we have to tackle all the urinary problems, and the kidney problems, and this is a thing. And definitely the whatever we need to study in the 5.5 years, the doctors what they study, we are compressing and making it in a 3 months for the spiritual healers, and for to have the better imagination. And and this is a beginning, not the end. End course ends means not, don't stop learning, and don't stop, close your book and forget. Not like that. That is the beginning. That is the beginning of your journey, and keep going. And I have already given you the nursing level the text to you. They are the private the notes. go through, understand, and if you in case of any doubt, discuss with me. And no, I'm not a master. I can't say that I'm a master in everything. Definitely, there are many people around me. They're specialists in some different diseases. Like, and I will consult them, and I will come back to you, and we'll tell how we can help them spiritually. Okay. Now, to end this, we any doubt on this one, and what if I anywhere I need to focus more, or you can say any suggestion to improvise my this class, because there were so many videos, but there were a repetition, so I skipped those videos. And that one video was total, and I think so you all enjoyed the dissection video, how physically we see that in our body, how it exists, so that when you heal, or you can say even in Reiki healing, when you are healing the organ, your thought, so, or you can infusing the thought in the water, or you can say directly infusing, or you can say infusing through the instruments. Definitely that that you require the knowledge of the shape and other thing. Okay. So tell me anything which I need to improve upon, and any doubt, please, so that anything I need to concentrate more, please tell me. We will think about that in future.
No, sir. I think we are good, sir.
We are going good.
We're good.
Yeah. We know that these 2 hours compressing a whole the urinary system. We can't do it. We can't touch all the parts, but that gross idea about the urine system, why it is actually required, and why BP and the kidneys are connected. If vice versa, the kidneys, they control our BP, and they control our the blood contents in our body. So it should be approximately 8 liters should be there, 6 to 8 liter, right? So that it will mean if it is going low because of some accident, though suddenly that our heart and kidney, they stimulate. There was a video on that. That will make and secrete they stop the urine, and that part of that liquid will be flown to the blood, and it creates a homeostasis. Homeostasis is the biggest advantage, that is an automatic system, auto gear, as good as auto gear vehicle. It chooses, and you pass that speed, it automatically goes to the next gear, like that. And any doubts, please?
Sir, the session as usual was fantastic. That too, sir, making people sit on a Sunday morning for 2 hours is very, very difficult, sir. So your class is like so interesting that, uh, thank you, sir.
Thank you. Thank you, Kumar sir. Thank you so much. I know that Sunday is very valuable to everyone, and some people are only free on that Sunday. So I also uh, in helpless in this case, but we are learning something. But never keep any doubt with you. If you have any doubt, or you can suggestion, please come out. We will rectify our any mistake we are doing, when we'll do, and the way you want to convey, all we will do, sir. So with this, I think I taken more than 2 hours today. So thank you
Sir,
for
one small thing, sir. Sir, you say you had sent some quantum healing, the cosmic revivals. What was that, sir, actually?
I'll tell you. 1 second. I will
Sent one.